A Swedish court rules against a midwife who refused to perform abortions. Eleanor Grimart claims she was discriminated against and denied jobs because of her pro-life stance. Sweden's labor court said last week it found no cause her freedom of opinion and expression had been violated. Grimart is considering taking her case to the European Court of Human Rights. This case is not the only one where religious liberty and pro-life issues intersect in the courtroom or in the hospital. To further examine the role religious liberty plays in being pro-life, we are joined by tonight's expert panel. Lewis Brown serves at the Christ Medicus Foundation, and Kellie Fiedorek serves as legal counsel with Alliance Defending Freedom. Thank you both for being here.
Thanks, Catherine, for having us.
So first off, what is your reaction to this Swedish court ruling? What is this signal to pro-lifers?
Well, it's really unthinkable that the government is trying to make as a condition of employment of the medical professional's willingness to perform an abortion. I mean, this poor woman, Eleanor, she's been 3 times denied a job simply because she wants to protect life. But I think really this is more symptomatic of a much larger problem that we're seeing across not only Europe, but here in the United States, where healthcare providers are no longer able to uphold the Hippocratic oath they take to do no harm. And I think the bottom line is, will those medical professionals, doctors, nurses, nurse practitioners, will they be able to go into the profession and stay in there and save lives? Or will they be forced by the government to leave the profession because they can't violate their conscience and end a life?
Right, and Catherine, what you're seeing is the danger of where we could go in the United States if we fail to protect the right of conscience, the right of religious freedom in healthcare. You're no longer talking about whether abortion should be legal or not, but we're now saying the government is going to potentially in the United States, if we don't protect conscience, compel folks in the medical profession, hospitals, healthcare providers to actually do abortions, or you can't be in the profession whatsoever, and that's not a place where we want to go as Americans.
This isn't just an issue that's abroad, like you mentioned. And Kellie, your group is working on a case in California that deals with religious liberty in healthcare. Can you talk about that?
That's right. Well, in 2015, California passed a law that essentially forces pregnancy resource centers to become essentially a free advertising agency for the abortion industry. It forces them to promote abortion and also to post signs in their windows telling women where they can go to get an abortion, including places like Planned Parenthood. But this violates these pregnancy care centers, violates their First Amendment freedom, their freedom to be able to speak, freely speak a message consistent with their conscience. And so we've appealed the Ninth Circuit Court of Appeals ruling to the U.S. Supreme Court, asking them to preserve these pregnancy resource centers who are really just trying to serve women, bring them hope, bring them free services, bring them free diapers, trying to protect them so that they're not punished for their pro-life views.
And Lewis, your group, the Christ Medicus Foundation, was created in part to protect religious freedom in our healthcare. Why is this something that Catholics and pro-lifers need to seriously consider?
Sure. If we don't protect the right of conscience in healthcare, we can't have a culture of life in the United States of America. If we don't protect the right of conscience in healthcare, we really can't be who we are as Americans. If we really want the best quality medical system in the world, we have to have one that is free, which means we have to have one that is based on the patient, based on the person, the decision between the physician and the patient. If we have the government stepping in, compelling physicians to perform certain procedures, compelling physicians to do things that are not consistent with what they believe they ought to do, what's best for the patient, what's consistent with their conscience, we can't have a free healthcare system. We can't have a quality healthcare system. We can't have one that's based on the patient. It would be based on the government. And so we don't want to see that. We want to see an American healthcare system where folks have access to care, but where doctors and patients are making that decision consistent with their conscience, consistent with their religious freedom.
Kellie, the Supreme Court case Doback versus Burwell was sent back down to the lower courts. It dealt with whether religious nonprofits are required to provide contraception to their employees. You represent clients involved in this case. What's the latest?
Well, the cases are still pending down in the lower courts, and we're hopeful that the Trump administration will soon issue new regulations that protect these colleges, these universities, and nonprofits, including Little Sisters of the Poor, will protect their freedom to provide employee healthcare coverage that's consistent with their conscience, and as Lewis was saying, that doesn't force them to violate the very convictions that inspire them to serve.
Lewis, you sat down recently with President Trump along with other healthcare leaders. What was your message to our president, and how did he respond?
My message to the president was the importance of protecting the right of conscience when it comes to taxpayers, so that they're not forced to be paying for the public funding of abortion in healthcare. And he was very receptive to that. He's very supportive of prohibiting the public funding of abortion in healthcare. I find him to be receptive of it. And he's also very receptive and very supportive, along with Secretary Price, both of them together, very supportive of having an American healthcare system that's based on the patient, not the government at the center. And part of what we saw in the last administration was the government being at the center of healthcare, saying, essentially, we want to subsidize the public funding of abortion, which violates the conscience of all of us as tax-paying Americans.
Kellie, what is your hope from the Trump administration when it comes to religious liberty and life-affirming healthcare?
Well, you know, he's talked about all these threats, so it's really no surprise that the Trump administration, or President Trump, during his campaign was very clear that one of his first priorities was going to be to protect religious freedom. And we've seen a leaked draft, and our hope is that he will sign that executive order, that he will protect the freedom of all Americans to live consistent with their core convictions. I mean, this is our heritage, this is who we are as Americans, and so it's only common sense that he would sign this executive order and also encourage his agencies to repeal and rescind some of the regulations that really thwarted and infringed upon some of our most fundamental First Amendment freedoms, that he'll stand for the freedom of all Americans and restore balance and tolerance to the people living in this great country.
Louis, you are calling on Congress to put conscience protection into our health care. What exactly are you hoping to see, and do you think it's likely?
Sure. There's two things. The first is the Conscience Protection Act, which would effectively protect medical providers, doctors, physicians, healthcare entities from being coerced by the local or the federal government into any way participating in an abortion, facilitating it, funding it, operating it, doing it. But we also, more long-term, want to see a federal law that says folks that have a moral or religious objection to doing some type of practice or procedure are free to not do that. They're protected if they refuse to do a certain procedure that violates their faith, that violates their conscience. And we know that conscience is the first freedom. If we don't protect the right to believe, the right to do what we believe we ought to do, we can't have a democracy. And so that's why it's so fundamentally important.
This is something we'll continue to follow closely here. Kellie Fiedorek, Louis Brown, thank you both for being here.
Thanks for having us.
Thank you.